In this video, we want to talk about a pretty common running injury, Achilles tendonitis or Achilles tendinopathy. First, a little bit of anatomy. The Achilles tendon is a thick band of tissue that runs from the calf muscles, the gastroc and the soleus, down the back of the lower leg and attaches at the heel. It helps us forward flex our foot. If you're suffering from Achilles tendonitis, you might feel some dull to sharp, aching pain at anywhere down the length of the Achilles tendon. Now, the funny thing about Achilles tendonitis, sometimes it actually feels better during running, but it's definitely going to hurt worse after running and after rest. All right, now we've done some videos on strengthening and stretching exercises that you can do to help prevent injuries. But what happens if you find yourself with some of that pain that you think might be related to Achilles tendonitis? Well, the first thing you need to do is exercise dynamic rest. And by that, what we mean is you don't have to completely stop all activities, just stop the activities that you know make it worse. So if you feel a lot worse after running, what you might want to do instead is swim or do some pool running, maybe do your workouts on an elliptical trainer or a stationary bike instead. Also, ice can be very helpful. Try icing for 15 to 20 minutes several times a day right over the area of pain. Finally, a lot of people get a little benefit from using anti-inflammatories like ibuprofen or Aleve. If you use these, be sure and use them just as how they say on the bottle, and don't use them for more than 7 to 10 days without talking to a doctor. Now, on our stretching video, we showed the calf stretch. The one thing I want to stress here is that if you're dealing with Achilles tendonitis and you're going to do the calf stretches, make sure you stop at the point of pain. This is a pain you don't want to stretch through or push through. So do gentle, cautious stretching of the Achilles, just like we showed you, where you dip the heel below the level of the rest of the foot. You can do it both straight-legged, then with a little bend in the knee, but be careful here because this is when the stretch moves right into the Achilles tendon. Now, also on the video for strengthening, we talked about calf strengthening, but with Achilles tendonitis, we're going to talk about a particular type called eccentric strengthening, and that is strengthening, or the exercise actually occurs while the muscle is lengthening. So you go up onto your toe just like normal, but now you come down very slowly, dropping that heel very slowly over like 5 to 10 seconds down to below the level of the rest of your foot. That right there is an eccentric exercise, and it can be very, very helpful for Achilles tendonitis. So try doing about 10 reps of that on each side. Also remember plyometrics. We've talked about that in our exercise video, but that's the explosive exercises with jumping, such as like the squat jump, and also the split jump, which is like a jumping version of lunges. All right. So for the last point, when should you see a doctor? Well, if you have pain that lasts more than a week or two, you should probably see a doctor. Also, if you're doing some of the exercises and things that we've described in this video and you don't seem like you're getting any better, also see a doctor. If you have pain bad enough that makes you actually limp, you should probably see a doctor. And then the last thing, anytime that you have any redness or swelling along the course of the Achilles tendon with the pain, that's definitely a sign that you should see a doctor. I hope this video has been helpful. Please feel free to refer others to it and check out our strengthening and stretching videos also. Thanks.